there are almost never any warning signs that a stroke is about to happen. For most people, stroke, and this sounds strange, is a fate worse than death. In fact, it's not a high death rate that causes so much grief and consternation in stroke. It's the fact that we're so significantly disabled after these events.
I became confused, and then I noticed that I was weak on the left-hand side, and as I started to pedal, one of my foot fell off the pedal, so I got off the bike, fell to the ground, and then I called for help.
I think what really benefited Randy was that he and his wife very quickly recognized the symptoms he was having and notified 911 immediately. What we want patients to do under those circumstances is to be brought to the closest stroke center. Bypassing this hospital or that hospital, if that's going to take precious minutes or hours to get to that facility, understand precious portions of the brain are dying off as that stroke occurs.
In the moment that a stroke occurs, people rarely experience pain. Instead, they're faced with physical dysfunction. For some, the most apparent symptom, from a bystander's point of view, is facial droop. The muscles in one side of the face will give out involuntarily. As blood flow is interrupted through the brain during a stroke, different parts of it may be damaged.
When it comes to stroke, we say time is brain. In fact, every minute that goes by while that stroke is in evolution, 1.9 million nerve cells are dying off.
Another potential dysfunction from a person having a stroke? An arm or leg on one side of the victim can become weak. Speech might become slurred or difficult to understand. There's a handy acronym to remember each of these and what to do about them as they occur. Face, arm, speech, time, as in, it's time to call 911.
The sooner a patient gets to an emergency room and stroke center, the better outcome we anticipate seeing in those patients.
Here are some ways that you can avoid a stroke altogether.
When we talk about prevention of strokes, there are things we call medically modifiable risk factors. That would include the most common ones, which are hypertension or high blood pressure, high cholesterol, diabetes, and some heart problems, particularly one known as atrial fibrillation. All of those, again, are medically modifiable risk factors, which is to say you can take medication that can get in the way of those leading to stroke. There's another type of risk factor, though, that we look at, and those are behavioral risk factors. We otherwise know these to be lifestyle choices: smoking, heavy alcohol use, obesity, poor dietary choices, and sedentary lifestyle.
My speech is a little bit weaker than it was before, but I think that's coming back too as the days progress.
How are you?
Good.
Good to see you. You're looking well.
Thanks.
Rehabilitation can be on the order of days, weeks, months, even years in some cases, where recovery of function isn't fully felt for a year and a half, 2 years, maybe sometimes longer. On an occasional case, a patient with a stroke has such a small stroke that there's no rehabilitation needed at all.
Well, I was only in the hospital for 6 days, so I recovered fairly quickly. And pretty much by the second day, I had regained most of the strength in my left side. I have an 18-month-old granddaughter and a grandson on the way, and I want to be able to play with them. I want to enjoy them.